Well, hello everybody. My name is Emily Bright with DocStyle.com. I'm hosting this webinar on behalf of DocStyle. Today, we'll share more about surgeries to treat adult spinal deformities, specifically surgical procedures for adult spinal deformity. At the end of this presentation, viewers are invited to schedule a remote consultation with a doctor who performs this procedure. We will also be answering questions throughout the webinar to help you learn more. Okay, so let's begin. Adults that undergo surgery and end up with a balanced spine, which means that the head is positioned directly over the pelvis front to back and side to side, can achieve a high degree of satisfaction after the procedure. Surgical options are spinal fusion, osteotomy, and decompression. Spinal fusion is the most common type of surgery for spinal deformities in adults. Osteotomies are required for adults with very large and rigid curves, and decompression is used when an adult has a degenerative scoliosis and spinal stenosis. Each of the procedures includes the removal of affected vertebrae or bony projections and permanent connection of two or more vertebrae. This eliminates motion between them and helps to correct any current curvature and helps to prevent advancements of the curvature in the future. Benefits? These procedures can help to relieve symptoms including pain, stiffness and numbness, restore the ability to stand erect, relieve pressure on organs such as the heart and lungs, prevent deformities from progressing, and improve overall quality of life. These procedures specifically treat the spine. Patients who opt for this procedure often do so to treat spinal deformities caused by spinal weakness and instability, post-traumatic injuries, congenital disorders, scoliosis, hyperkyphosis, chin-on-chest syndrome, flat back syndrome, and ankylosing spondylitis. Let's take a look at the procedure. There are some differences depending on the specific surgery, but for the most part, the steps are as follows. Step 1. The patient is put to sleep using general anesthesia and laid face down or on their side. Step 2. The area for the incision is cleaned and draped. Step 3. The incision is made by the surgeon and can be located in several different places depending on the area of the back that is affected and the degree of the curvature. These can include the neck, back, directly over the spine or on either side of it, and/or the abdomen or waist. Step 4. The surgeon will remove the affected vertebrae or bony projections. Step 5. The spine is straightened by attaching rods to the hooks or screws. Step 6. To fuse the vertebrae together permanently, the surgeon will place bone graft material between the vertebrae. Step 7. The spine is then repositioned and the screws and hooks are tightened securely to the rod. Step 8. A chest tube may be placed to drain fluid out of the chest for the first 2 days after surgery. Other drainage tubes may be placed to drain fluid from the surgical site. Step 9. The incision is then closed with stitches and the area is bandaged. Step 10. The patient is fitted with a brace for support during the healing process. The length of this procedure depends on many factors. However, these are intricate procedures and patients are typically in surgery for several hours while it's performed. After surgery, the patient will be immediately transferred to a recovery room for several hours of observation. The first 24 hours will be spent in an ICU setting before being moved to an orthopedic unit. Most patients are then hospitalized for 5 to 7 days. Physical therapy will begin by helping the patient out of bed and to a chair. This will progress as tolerated to walking and climbing stairs. Before being discharged, spinal x-rays are taken to make sure that there are no early problems with the graft or spinal alignment. The patients will be discharged with instructions about bathing, dressing care, and resuming activities. Spinal surgery patients can anticipate being out of work for 2 to 4 weeks following the surgery. Their level of activity will depend on the procedure performed and the healing process of the patient. Typically, strenuous activities are not allowed until the patient is 2 to 6 months post-op. Serious surgeries like this can carry some risk. Your doctor will discuss specific risks with you in more detail, but possibilities include decreased mobility, spinal cord injury, spinal instability, failed back surgery syndrome, nerve damage, and tissue damage. As with any surgery, bleeding, infection, DVT, risks associated with general anesthesia, and death are possible. The exact cost of this treatment depends on many factors. However, insurance typically covers all or part of this procedure, including both Medicare and Medicaid. If you would like to schedule a consultation to learn more about surgical procedures for adult spinal deformity, click our link to connect with a doctor. Thank you all for your time.